Let's talk about the types of bone tissue. Two types of general structural organizations characterize bone: compact bone and spongy bone. Compact bone represents the external layer of all bone and makes up the majority of the diaphyses, or the shaft, of the long bones. Compact bone is the stronger of the two types of bone. Compact bone, which accounts for approximately 80% of the skeleton, is arranged in units called osteons, or Haversian systems. Blood vessels, lymphatic vessels, and nerves perforate the periosteum and course through the compact bone through perforating canals, which are also known as Volkmann's canals. Concentric lamellae surround a central canal, enveloping the canal in a ring of calcified matrix. Between the lamellae are small spaces called lacunae, in which the osteocytes are located. Tiny canaliculi radiate around the lacunae and provide a route for ingress of nutrients and oxygen on the one hand, and egress of wastes and carbon dioxide on the other. Spongy bone, in contrast to compact bone, does not contain osteons. Instead, spongy bone consists of lamellae that are arranged irregularly in a three-dimensional lattice of thin columns of bone called trabeculae, which has a web-like structure. In some bones, these open spaces harbor hematopoietic red blood marrow. These open spaces harbor hematopoietic red bone marrow. Spongy bone, by virtue of its more open structure, undergoes a more rapid turnover of bone minerals. This type of bone is found inside short, flat, and irregular bones and at the ends or epiphyses of long bones. Spongy bone is also found in healing fractures, where the callus is relatively disorganized. In effect, spongy bone serves as a framework on which to fashion a more permanent structure. So let's talk also about the epidemiology. Women are at higher risk for osteoporosis than are men because they have smaller bones and because of the loss of estrogen at menopause. In women, forearm fractures increase in incidence after 45 years of age, and by 65 years of age the incidence of hip fractures rises. In men, the incidence of osteoporotic fractures increases after 75 years of age, and after 85 years of age, fracture of the hip is the most common sight. African Americans have greater bone mineral density, BMD, in adult than whites, a discrepancy attributable to bone size, muscle strength, and bone fat composition.